it's a breeze in the air too. The disparities in treatment for Black Americans with colorectal cancer is really startling, but there is a brighter side to the story. And joining us live is Dr. Cedric McFadden, giving us what we need to know about colorectal cancer, what we need to look out for. Doctor, thank you so much for joining us. I did want to start out with a startling statistic. Black Americans are both 35% more likely to die from colorectal cancer and 20% more likely to develop it than non-Hispanic whites. Why is this? Have we found out what makes us so vulnerable to this?
Well, there are lots of theories out. We can start by, first of all, saying that we know that colorectal cancer is preventable. So if we can find polyps, we can prevent that polyp from becoming a cancer. One of the biggest challenges that we find in the Black community is access to care. And not only access to care, access to quality care that, number one, encourages that screening to occur. So if people can't afford the test, if people can't get to the test, and if people aren't getting the recommendation for the test, then we're not going to be preventing cancers. And we also know there's a genetic link. So having a family history increases the risk. And so if you can imagine, if Blacks are 20% more likely to be diagnosed, then that genetic link carries down as well. And there are also some lifestyle factors as well, such as obesity, eating the right types of foods, or having tobacco use as well, alcohol use, that can also increase that risk of colorectal cancer. So all of that together may influence, but it may not completely explain all the variables.
And doctor, are there stigmas that surround colorectal cancer that would prevent someone from getting checked?
Well, I think one of the biggest stigmas that we see, historically when people think about colorectal cancer, they're thinking about getting a colonoscopy. And for many people, and often, I hate to say, in men, they don't want to get a colonoscopy for fear of what that could mean for them having that type of an exam. But having spoken with very great patients who advocate this, they will comment any day that they'll prefer to have a colonoscopy over having surgery and needing chemotherapy. So, those stigmas can be prohibitive to getting the care that you need to prevent these cancers from occurring.
And what symptoms would immediately stick out to you that would warrant a visit to the doctor, or something that is really troubling that you really need to get examined and checked out?
Well, it doesn't take much blood in the toilet to encourage someone that there's a problem, right? So often we'll see patients come in with bleeding. They'll have changes in abdominal habits, changes in bowel habits, abdominal discomfort, fatigue, weakness, or even unexplained weight loss. But here's the key. You don't have to have symptoms to have colorectal cancer, meaning if you have an early polyp or early cancer, you may not have any symptoms at all. So we don't want you to wait for symptoms. We want you to be screened. GetScreened.org is a website that helps you navigate that screening process.
Perfect. And doctor, this is a potentially deadly disease, but again, it's not 100% fatal all the time. There is still care and there is still support for these patients, correct?
There is still care, and let me just say, if caught early enough, the survival can be over 90%. And for anyone who's gotten a diagnosis of cancer, it can be very nerve-wracking, hearing the words, understanding the language. So going to bluehq.org gives you a lot of the support, the resources, understanding about the resources with research to get you the care that you need and to help you navigate through the process.
Perfect. Dr. Cedric McFadden, we appreciate your time. Thank you so much for speaking with us today.
Thank you for having me, Melanie.
Okay, 9:19 is your time right now. Let's get you back outside with Adam Epstein.
Thank you very much, Melanie. So we're taking